Another broken promise from this government and a broken healthcare system this government has a responsibility to fix. Mr. Speaker, as the week goes on, we're hearing that the first patient is just one of many shipped down the highway to receive substandard care outside of the healthcare system. And what's worse, once they're outside of that healthcare system, they no longer have the ability to escalate the issues that they've experienced. My constituents are wondering if they're safe to be discharged from hospital at all. So to the minister, how many Calgarians receiving care in hospital have been discharged to motels in my city?
The Honourable, the Minister of Health.
Mr. Speaker, we have been very clear that in this particular case, the individual worked with the social worker within Alberta Health Services. When they had completed their course of medical treatment, they then were, together with their social worker and other allied health professionals, chose the site that they wanted to go to, the provider. The provider was not transparent with the client. They should have told them where they were taking them. That is unacceptable, and we're looking to correct that.
The Honourable Member for Calgary-Klein.
Making a choice requires knowing what those choices are. So given that this government finds a way to choose private health care at every opportunity, and given that this government is picking apart and dismantling public health care through private surgeries, private facilities, and cancelling the public hospitals Albertans need, and given that the patients now staying at private motels when they've been led to believe that they'll be discharged to safe, supportive places to live, are the people this government is discharging to motels at least eligible for a points program in this motel scheme?
Good question.
The Honourable, the Minister of Health.
Mr. Speaker, it's apparent the members opposite are really good at theatre, but Mr. Speaker, on this side of the House, we want to solve real problems. Mr. Speaker, we have identified a gap in the process, and we are going to do everything possible to...
Order. Honourable members will come to order. The Minister of Health.
As I said, Mr. Speaker, they like to yell and scream, but at the end of the day, they don't actually do the work. We're doing the work to make sure that every patient that leaves hospital, even when they do not require medical care any longer, when they require housing, that they will actually get the supports that they need, Mr. Speaker. We've got a cross-ministry approach, and Mr. Speaker, I'm confident that we will get the job done.
The Honourable Member for Calgary-Klein.
Given that all this motel medicine actually starts with the Premier, who said publicly that she wants patients discharged to motels, and given that the Premier said she's discharged hundreds of Albertans to clear out overcapacity in hospitals struggling to find space for backlog surgeries, and given that Calgarians rightly deserve to know whether this whole scheme is a plan to further private health care, can the Minister of Health assure my constituents today that no more patients will be sent to a motel, yes or no?
The Honourable Minister of Seniors, Community and Social Services.
Speaker, again, the NDP are having trouble listening. There are 0 patients being treated in hospital, Mr. Speaker. Patients are treated in the hospital through the healthcare system. When patients have been successfully treated, they are discharged, Mr. Speaker. And yes, we do have sometimes complex situations that require multiple ministry approaches, which is what the Premier is doing. So what the Premier is doing, Mr. Speaker, is making sure people are in appropriate levels of care, unlike what the NDP did, Mr. Speaker. And that's what we're going to continue to do. While I understand the NDP want the homeless to live in tents and seniors to live in hospitals, we want to make sure everybody lives in appropriate beds for their care.